My name's Amy Titchin and I'm a trainee advanced paediatric nurse practitioner. I've been on the ward for kind of 10 to 12 years. I started my trainee ACP role about 18 months ago, so I'm about halfway through that course.
Hi, Cara.
Supervision is really important for me, I think, for the success of me completing this kind of programme. It's important for my development of my kind of clinical knowledge and developing myself as a practitioner. But also it's vital for the support in the transition between senior staff nurse up to kind of practitioner level.
I work with Amy on the paediatric assessment unit, and we probably work 1 or 2 shifts together a week. So she's seeing patients either independently and then reporting back and discussing through her decisions, or we're going in together to see a patient and again discussing through treatment options. Before she even started her training, she was really well respected by all the rest of the nurses. People are really pleased when she's on shift, and she's just very sensible.
I worked with Amy as a senior nurse here, and she's brought all that experience, the calm, caring, kind nature that she had as a senior nurse, and is now adding to that with the advanced skills that she's learning through the course. And it's brilliant for us as a department. It's really nice for Amy, hopefully, as well. My role really is to make sure that she's getting the opportunities through our service to become the practitioner that we kind of think she can be, and that will help our patients.
I've known Tom for quite a while, so we've had that relationship, so it's very easy to kind of have these kind of communications with, and it's a very supportive environment.
I think supervision is really important, particularly in an advanced practice role. You're going from one role, so a nurse, to a completely different role, so potentially plugging gaps in a registrar rota, so having somebody there to support you, guide you, and also help you learn the clinical aspects of the job is really important.
I think one of the cases that we've discussed in supervision was the case of a small baby that presented acutely unwell effectively, and the differential wasn't clear. Amy saw them initially.
I could see that they were very poorly. I knew what I kind of wanted to do. Lucy came in quite soon afterwards.
And it was nice to see that Amy had stayed really calm throughout her initial assessment. She recognised what was wrong and she recognised what needed to be done.
Having Lucy there as that support and affirming kind of my decision making was really important for me to have that kind of confidence and that courage to kind of voice my concerns.
The patient looked really unwell, so we had to put oxygen on and treat them for potential sepsis. And if you've got a patient who's really, really sick, that then needs to be escalated as well. So that was quite nice to have the different levels of supervision. So kind of Amy as a trainee, then me as her supervisor, and then bringing in the consultant who agreed with all the treatment we were giving, which was really nice. Everything had been done really well.
After we kind of stabilised this child, we went back and reflected over that. And I thought that was really important, to be able to do that straight after that case when it's still fresh in your mind.
That's why I see it as a real apprenticeship. You are safely doing the job with your own hands, immediately supervised, and then you can have detailed conversations away from the patient.
I think the role of the supervisor is brilliant. Like each day I work with her, I can see her becoming more and more confident seeing patients. And yeah, it's just really exciting to see that journey.
There is funding available effectively for time to do the supervision, which makes a big difference. What we then take is the governance structure and then add a clinical context, which for us as paediatrics, to that core training that she's receiving through the university. I think we'd really be in a difficult spot if we weren't investing in the nurse practitioners and investing in trainees to bring this new way of working through and into paediatrics.
I'm really lucky to be able to have a good setup here. So yeah, hopefully all will be passed in 18 months' time.